Hi everyone, and this is Ashwini from Space Academy. So today's topic is about policies. So what is a policy? A policy is a course of action or a principle of action adopted and proposed by a state. What is the main objective of such policies that the governments make is, firstly, it is for the development of the nation. However, the trend has changed. So earlier the policies were made for the development of the country, just the development of the country. But now the states are making such policies, okay, where it is inclined to sustainable development. Okay. So, for example, we have national energy policy, national economic policy, national, health policy, national civil aviation policies, and we have so many policies. Now, what are the importance of such policies? Okay. So, the first importance is it aids for the development of the country. Now, the nations understood that making policies for their own development, okay, will not lead for a long term. So they are making more collaborative and cooperative policies. For example, recently India-US ministerial meetings, it is called as India-US Economic and Finance Partnership, where they asserted the importance of having supportive policies until and unless inclusive economic recovery is done. We are living in a pandemic era where, almost all the nations have experienced the downfall in an economy. So this particular meeting is to have policies until and unless, there is an inclusive economic recovery is obtained. They talked about climate financing. They talked about finance regulations, technology collaborations, and they also talked about what is it? They talked about anti-money laundering, etc. So, secondly, the policies are important because it reduces the dependence on other countries. Okay, historically speaking, we know that post-independence, India was making policies that were more rigid and inward-looking. Like it was, it was making policies to make more self-reliant and also to reduce our dependence on the other countries. So it was an optimistic period, but then what happened was the policies were stagnated. The nature of the policies did not change according to the changing nature of the society. So what happened is there was a stagnation in the policies, where our neighbor countries like Bhutan and Southeastern Asian countries, like Myanmar and all, they were making policies that were more inclined to export oriented. They were having growth strategies. So post which that led to this stagnation period led to the balance of payment crisis. In so post which we had this 1991 LPG reforms, liberalization, privatization, and globalization reforms, where we started making policies to which were inclined to globalization. Okay, and India was made more open. The market of India was made more open, and of course it was fruitful. And the next importance of policy is it highlights how the country has transformed from agricultural sector to the service oriented sector, how we transformed from shortages to surplus, how we transformed from basic survival to global power. Now earlier our policies were only to for the development of the country, only for the basic survival of the country. Now the trend has changed to how to make India a global power. And lastly speaking, the policy is also says how government has proposed to deliver their services, how government is able to tackle the challenges that is existing in the society, in providing basic utility services for the public, in health sector, in education sector, technology sector, transportation sector, and how are these policies will be able to change socio-economically to the citizens. And as we are living in this COVID era, it has changed. The pandemic has definitely affected two important most sectors like health, economy, and other sectors as well. Now, talking about health, India has not put up a good show in the health sector. And the last national health policy was in 2017. So let's talk about the national health policy of 2017. It was proposed to improve the quality services with respect to health. It was made to improve the access to the quality healthcare services, to reduce the costs, and also to provide a uniform healthcare services despite the financial barriers that citizens face. Now it also talked about improving the access, improving the quality of health services, and also it emphasized on free drugs, free diagnostics, and free emergency services in the public healthcare setups. And they talked about to increase the life expectancy from 67.5 to 70 by 2025. It talked about how to reduce the infant mortality rate, maternal mortality rate, how to reduce the non-communicable diseases. According to an Apollo study recently, more than 65% of the deaths happen due to non-communicable diseases like your cardiovascular ailments, like diabetes, etc. And it not only affects the health of a person, but in turn it affects the productivity and also the economy at the end. So it is important to focus on non-communicable diseases as well, and it laid emphasis on how to improve the utilization of public health services, by at least 50% by 2025. So as it was all talking about this, it also highlighted the importance of Ayush. Ayush stands for Ayurveda, Yoga, Unani, Siddha, Homeopathy, etc. And it also said about the global HIV target, 90 is to 90 is to 90. It means that 90% of all people who are with HIV should know their HIV status. The next 90 years, 90% of all those who have been diagnosed with HIV should receive antiretroviral therapy. And the last 90 stands for 90% of those who are receiving this therapy should be able to suppress the virus in their body. So this is about the target. Okay, and yes, and as health is a state subject, okay, it is in the state list according to the 7th schedule. Okay, it needs a collaborative approach of the center as well as the state to improve its quality and also to improve the accessibility and affordability for the citizens. Okay, and the national health policy also tells about also lays emphasis on to increase the public health expenditure by at least 2.5% percentage of the GDP. And I'll come back to this later, but there is an ongoing debate of to make right to health as a fundamental right. Despite so many years we have faced some shortfalls in the health sector. So there is a debate that is ongoing. Okay, to make right to health a fundamental right. So what does it make? It makes the right justiciable, enforceable. That is, it makes the government more accountable. It makes the state more accountable, to provide better services, better health services. So what is this right to health? How do you define this right to health? So right to health is nothing but a person's right to remain healthy and also be able to access, okay, healthcare, quality healthcare services, and also preventive healthcare services like adequate food, water, sanitation, etc. So which will prevent them from having illness or diseases. To WHO norm, okay, the doctor to population ratio has to be 1 is to 1000. But in India, it is 1 is to more than 1500. That is, there is one doctor for more than 1500 patients. And the nurse to population ratio has to be 1 is to 300, where in India it is 1 is to more than 600. And government hospital beds to population ratio is 5 beds for every 1000 people according to WHO norm. But in India, it is 0.55 for every 1000 people. So, and even there is a shortfall in the primary health centers, community health centers, and other centers, other sub centers. Okay, and let me also give you one more data. That is, according to Ministry of Health and Family Welfare, according to the rural health statistics, it said that there is a 70% shortfall in physicians and doctors and surgeons and gynecologists, etc. So as we all know, more than 60% of the Indian population reside in the rural and remote areas. So they need this healthcare services more than anybody. So, but there is, according to the statistics, there is 70% shortfall in that. So that is there. And recently the union budget of 2020 and 21 also said that they have to increase the health expenditure, around 2.5 percentage of the GDP. On a comparative basis, even Bhutan is spending 3.5% of its GDP to health, and Sri Lanka is also spending more. So I think we can learn from these countries and to improve the health expenditure. And improving the health expenditure or increasing it also has one more benefit, that it reduces the out of pocket expenditure. What is this out of pocket expenditure for a normal person? Okay, according to a study, according to a survey, it said that more than 65% of the unexpected expenses, that's out of pocket expenditure, okay, comes only because of the ailments, because of the health. So increasing the public expenditure will reduce these out of pocket expenditures by at least 30%. More and more out of pocket expenditure, it will lead people to poverty. And coupled with unemployment and seasonal unemployment, all of these will lead them to vicious cycle of poverty. So the policies that the government is making should have in all of these challenges into account, and also should address these challenges. In that way, right, making right to health, as a fundamental right, is a welcome move. And lastly, I would also like to tell that according to the World Health Organization, health is a complete state of physical, mental, and social well-being. So the policies should not only concentrate on the physical ailments. As there is more modernization and urbanization, the policies also should concentrate on the social well-being as well as the mental well-being. So if the policy is inclined to all of these things, and I think it would lead to a better stature in terms of health. Thank you.